we are still in the Medicare open enrollment season. And when are you eligible for Medicare? And what are your options? That's coming up next on WNIN Newsmakers. Welcome, I'm Noah Alazza, the Chief Communications Officer at the University of Evansville. Medicare open enrollment ends on December 7th this year. So here to talk about the basics of Medicare is Carolyn Connors with SWRCA and more, and Melanie Garland, the Southwestern Volunteer Supervisor for the Indiana State Health Insurance Assistance Program. Thank you both so much for being with us here today. We appreciate you making time. So first and foremost, let's start with you, Carolyn. What is SWRCA?
SWRCA is a nonprofit. We're part of the Area Agency on Aging Network, which covers the entire U.S., but obviously we're in Southwest Indiana. We empower individuals of all ages, seniors and those with disabilities, with information, supportive services, home care options, so that they can remain living in the community instead of going to a nursing home. We just provide so they can choose where they want to live.
And Melanie, how about you? What does SHIP entail?
Absolutely. So SHIP, like you said earlier, is the State Health Insurance Assistance Program. So we are housed within the Department of Insurance, and our goal is to be a free and impartial resource for people with Medicare. So we have community partnerships actually across the nation. We have a SHIP program in every state. And then here in Indiana, we have over 100 SHIP sites, and one of those SHIP sites is SWRCA and more. So we have about 5 options counselors that are trained there, that are certified SHIP counselors, to meet with people and give them free impartial advice on their Medicare and just kind of go over their options and just do all sorts of things to help them understand.
I'm curious, how closely do both of your organizations work together? Is this something that you're constantly communicating with, or do you work pretty much hand in hand?
Definitely. We get training at the state level. Melanie does our training to make sure we're always up to date with current information. And then if we have any questions, special cases, which there's always something, we run those by Melanie as well. So we work very close.
Let's get into the nuts and bolts of this, right? Okay, what is Medicare? You know, a lot of times, particularly for younger folks who might not necessarily know what it is, but even for older folks who are coming up on that, even in the most general terms, what is Medicare?
Medicare is healthcare insurance for the 65 years of age and older, or anybody with end-stage renal disease, or disabled individuals younger than 65 that have been on disability, Social Security disability, for at least 2 years.
And we're in the open enrollment period right now. How long does that run through, and what does that kind of process look like for individuals?
October 15th through December 7th is considered open enrollment, and that is a time where any Part D recipient, which is the Medicare drug plan, or Medicare Advantage plan members with Medicare can look at the options for the next year and make any changes based on their individual situation, as all of these plans change from year to year.
What is the difference between Medicaid and Medicare?
You want to take that?
Sure. So like Carolyn said, Medicare is for 3 groups of people. So over the age of 65, if you have been on Social Security disability for 2 years, or maybe a diagnosis of end-stage renal disease. But Medicaid, that is a state-ran program, so the eligibility can differ from state to state. And usually it's going to be based on your income and your resources, but it is health insurance for all groups of folks that qualify for it.
So can people sign up for Medicare at any time, or is it just during that enrollment period?
No, the open enrollment is not for new to Medicare. That's basically when you want to look at your options for the next the next year. The new to Medicare, the new enrollee, they have a 7-month window in which they can enroll so they have 3 months before their birthday month, the month of their birthday month, and 3 months after that birthday month. So they have a 7-month period to enroll in Medicare. And then we do educational, show them all their options so that they can make an informed decision about what kind of plan they want out of Medicare.
So let's walk through kind of the process then of signing up for Medicare. Is that something you can do online, in person, a combination of both? What does that process look like?
Absolutely. So when you are new to Medicare, so that window of time That is for you to sign up for your Medicare Part A and Part B. So some folks that may already be on Social Security benefits, they will automatically get their card 3 months before their Medicare starts. For others that are eligible for Medicare but may not be receiving Social Security benefits yet, they can sign up for Medicare through Social Security. So Social Security does handle the enrollment for Medicare, and they can do that as soon as 3 months before their Medicare starts, the month of, or the month after. So with Social Security, you can contact them online. You can enroll through their website. You can also go to the local office, or you can give them a call and schedule an appointment to sign up that way as well.
For viewers at home watching that might still be working right now, is it the recommendation that they go ahead and get Medicare? Do they wait? What is your advice or guidance?
Each situation is different, but what we normally do, we discuss with them what the options are depending on the healthcare plan, or if they have group insurance. Each group insurance might have a different regulation about once you turn 65, whether you stay on their plan or they mandate you enroll with Medicare. So that's the first place to start. They have to find out what their group plan requirements are, and then we help them think that through depending on what they say, and we educate them about the Medicare portion.
So Carolyn, you're saying it's on a case-by-case basis that they can get Medicare and still have potentially the supplemental work-provided insurance,
Yes.
correct? Okay.
Yes.
So some of the other basics then, what is the most basic coverage that you can get with Medicare?
Want me to take that one?
Yeah. Yeah.
Okay, so just with Medicare, so the most basic, so we kind of what we talk about it is we kind of say, the minimum coverage that you would need with Medicare to avoid penalties. So a big thing with Medicare is there is certain periods to do certain things, and you don't want to have a penalty if you didn't sign up on time. So to avoid those penalties, that minimum coverage is your original Medicare. So original Medicare is your Medicare Part A and Part B. And the reason we call it original is because it was what originally was put into legislation and how Medicare became. And then several years down the road, in the early 90s, they came out with the Medicare Part D. So then around 2006, they made it to where you're kind of required to have a Medicare Part D plan. And the reason we say kind of is if you don't enroll in it when you're first eligible, you could have a penalty later when you do want to get that Medicare Part D plan. So part of what the SHIP counselors and the SWRCA team does is they counsel folks on knowing, if they're working, when the best time is to enroll, giving them the resources on how the two may coordinate, and then also letting them know what their options are when they are ready. So where to go, where to find plans, and things like that.
So what are the 4 parts of Medicare?
Well, first, the Medicare A, Part A, that's the hospital. The B, which is the doctors, the labs, the tests, that's all. The A and B, that's original Medicare. And then if you have original Medicare, you would have 4 different little pieces to it. You would have the A and the B. You would have a Part D drug plan, which is sold by individual companies. And if that's on that Medicare.gov website, you can put in your prescriptions, and it will display which plans would cover your drugs at the best price. So it would be a drug plan. And then the Medicare supplement, also known as a Medigap plan, which again is sold by insurance companies that would cover parts of the A and B in most cases that Medicare doesn't pay for. So it's basically paying for the 20% that Medicare doesn't cover.
Yeah, so like the Part A, that is the one where it's 0 premium. So if you've worked 10 or more years and you've paid in your taxes into the Medicare pot, you have earned your premium-free Medicare Part A. Now Medicare Part B, that does have a monthly premium, and we say the standard premium for this year is $174.70. And the reason we say standard is there are some programs out there that can lower that cost, like where the state may pay your premiums if you are a lower income individual. Or on the other side of that, if you're a higher earner, based off of your tax income returns, you may pay a higher premium for your Medicare Part B. And then for 2025, that Part B premium, it does fluctuate from year to year, and next year it is going up. It's going to be $185 per month. Again, that standard rate. So those are the premiums for the Part A and the Part B. And then where Carolyn mentioned the supplements is those help pay the out-of-pocket costs that you can experience. So Part A and Part B both have their own deductibles and co-insurances, and those supplements can help offset those out-of-pocket costs. And then an alternative to that original Medicare, so that would be your third part, that would be your C. So if we're doing the alphabet, we've got A, B, we covered D, and then we'll go back and we'll pick up C. So that's your Medicare Advantage plans. And what that is, like we kind of mentioned, is it is a managed care program of Medicare. So it's an option that you have to enroll, and that private insurance company is now managing your Part A and your Part B. So they have to provide the same benefits, but they get to decide how they want to do that. So that's where your networks of providers can vary from plan to plan. And then they also offer a Part D benefit. Most of the Advantage plans do. And so then you don't have to get a separate prescription drug plan. You can use your Medicare Advantage plan for your medication coverage as well.
And I think we've touched on some of this briefly, but with Medicare covering, it doesn't necessarily cover everything. We know that, as you just mentioned, Melanie. What percentage does the insuree have to cover? I'm assuming that's on a case-by-case basis.
Depends on the type of plan.
Yeah, so there are, with original Medicare, there are deductibles associated with the Part A and the Part B benefits. So for example, Part A has a benefit deductible, and so that can restart as your inpatient. So Part A is for your inpatient hospital, anything that you're admitted into. And so that deductible can run almost every 60 days, depending. And this year it's $1,632, which we just got the new numbers for 2025, but I don't have them memorized yet. But so that can be an out-of-pocket expense for a beneficiary. And then what we more think about more commonly is the Part B deductible and coinsurance. So Part B covers, like Carolyn said, it covers the majority of your doctors, your specialists, anything that's outpatient. And that does have an annual deductible of $240. And then after that's met, it's an 80-20. So Medicare picks up 80%, beneficiaries responsible for 20%. There is no max out of pocket on those amounts. So that's where Medicare supplements, it's a private insurance policy that can pay, depending on which plan you pick, there are options with those as well. And then those can pay secondary to your original Medicare. So you still have original Medicare, and then you have that secondary insurance company that kind of swoops in and helps with taking the gaps in that coverage.
So what's the main difference then between original Medicare and the Medicare Advantage as you were talking about?
I would say network. With the Advantage plans, you have to make sure to get the best benefit of the plan, the doctors you see are part of their network. There's two different types of Advantage. One is HMO. You have to see doctors. If you have an Advantage HMO, you have to make sure the doctor you see is part of their network. If not, they won't pay anything. The PPO, you can go out of network, but you have a higher copay if they're not part of the network. So I think that's the biggest difference.
Absolutely. And it is a managed care plan. So one of the other differences is Medicare Advantage plans are usually lower in premiums than they would be for like a supplemental plan to your original Medicare. So depending on your budget and, kind of insurance is kind of that risk, but Advantage plans, they're going to have lower premiums, but instead of paying the original Medicare deductibles and coinsurances, you'll pay the coinsurances that the plan issues you, and that can vary from plan to plan. And the other difference between the original Medicare and Medicare Advantage plan is there is also no max out of pocket with original Medicare. So with the Medicare Advantage plan, even though you're paying copays, they do go towards that max out of pocket. But they are essentially managing your Medicare. So if you're thinking, well, I would rather be on original Medicare, then your choices would be more original Medicare, maybe a supplemental, and then a drug plan. So that would kind of be your three there. And that's what we start with when we meet with folks is we explain the differences. And, every year you can change that. You can stay on original Medicare or you can go to Medicare Advantage, and we talk about the things to consider before making those changes and things like that.
And I know there's a lot of insurance companies out there, but I'm just curious, are there any insurance companies that offer the Advantage plan just exclusively? How many maybe are there out there?
Most of the Advantage plan companies offer also the drug plans, or a lot of them offer the supplements as well. So they're in all of the different, types of plans that are available.
Yep, absolutely. And there's some Advantage plans, that are offered from the same company that have different max out of pockets, different deductibles. So you may have 4 different choices from company A. And so that's where we can help people understand, again, like, what are their needs, what are their providers, what meds are they taking, and then we help them make that choice from there.
I'm quite curious, too, if someone would benefit from more than basic coverage, but let's say they can't afford it necessarily, are there any types of programs that then they could go to help?
There's a Medicare savings program that we assist individuals with. We screen them, for instance, a single person with income no greater than $2,430 a month from all sources and limited resources could qualify for that Medicare savings program. And there's 3 different categories in there, and they help at different levels. But they could have their Part B premium paid for, the $174, which next year is going to be $185, I believe.
Yes, yeah, $185.
And get extra help on the cost of their medication. So it's a great program, and we do assist individuals through the process of applying for that.
Excellent. And I know, Melanie, that you mentioned, and you as well, Carolyn, that there were a couple of changes this year to Medicare. But for next year, is there anything people should be aware of, or even this year or next year, some changes?
Sure. The Medicare open enrollment period, just kind of going back to that, it is an important time because with your Part D coverage, whether it's through a prescription drug plan or a Medicare Advantage plan, it is ran by a private insurance company, and they are allowed to make changes from year to year. So those changes can be the medications that are covered, the pharmacies that are in network, the healthcare providers that are in network if it's a Medicare Advantage plan. So with the changes that they can make, that's why this time is so important for folks to review their current plans. I always tell people, if they say, oh, I love my current plan, well, that's great. Let's make sure you're going to love it next year. So it's always good just to kind of review those plans in general. But there are a few changes in 2025 with the Medicare Part D program, and this is part of the Inflation Reduction Act phases. And so what is happening next year is anyone on a Medicare Part D plan, whether it's a prescription drug or an Advantage plan, their out-of-pocket max for their medications, for their prescriptions, is $2,000. So this is the first time that they have had that low of a max out-of-pocket, which still seems like a lot of money, but there's a lot of expensive medications out there. So the folks that may be on those, it's pretty happy news for them. And then in addition to that, every Part D plan, again, through a prescription drug plan or an Advantage plan, they are required to offer a payment option. And so what that means is instead of paying, your deductibles or a higher copay for your medications all at once at the pharmacy, you can enroll into this payment plan where your Part D plan will issue you a monthly bill. So then you can kind of spread those monthly installments out instead of getting hit all at once, kind of spread it out throughout the year. So those are 2 new things that we're educating people about this year.
And when individuals are looking for different choices of Medicare, how do you determine what is the best option for yourself? If you're that individual, how would you go about determining what's best?
We, of course, meet with them individually, and it really depends on their individual healthcare situation, what their, who their doctor is, what prescriptions they're on, what pharmacy they use, the potential copays, and their individual healthcare situation. How often do they go to the doctor? Do they see a lot of specialists? All that is going to, or what we will do is educate them. Like if they go with a tract A, I call them different tracks with original Medicare and the different pieces, or with the Advantage, which one, so they can decide which one they would be best suited for.
Let's get into the resources of this where individuals can go, obviously with SORCA and SHIP. Can you just even from a very high level talk about the resources that your organization provides to help individuals looking for Medicare options? And Carolyn, maybe we start with you.
You mean different, how to get assistance?
Yeah, how could they get assistance or seek out additional resources through SORCA?
Okay. We do, through our ADRC, our resource department, we do meet with individuals personally. I was going to say individually, but that you say more twice. Anyway, we make appointments, meet with them. We do a lot of new to Medicare counseling, which is a big piece for them to understand and educate them about what their options are. So if if we have counselors available, we'll make appointments. We are unfortunately booked up for this open enrollment season, but there's assistance they can get through Medicare.gov, SSA.gov, which is Social Security, the SHIP site, which is Medicare.in.gov, or the SHIP hotline.
Yes, absolutely. So we have over 100 sites statewide, and kind of like what Carolyn was saying, sitting down and meeting with people one-on-one. So whether you're new to Medicare and you're wanting to learn more about that, or if you're like, I really want help to review my plan for next year, our SHIP counselors can do that as well. So our phone number to find a local SHIP site in your area is 1-800-452-4800.
Perfect. And I know sometimes folks don't have access to internet, so the phone call is the next best option. So we'll definitely be sure to include that.
And if they call SWRCA, we do have a list of other SHIP counselors in the area. We're booked up, but the others may not be booked up. So we will refer them somewhere else.
Excellent. So aside from reaching out to both of your organizations or both of you, is there a place where people can find more information just in general about Medicare enrollment, and where could they go?
Absolutely. So Social Security, the website, or even calling, they do handle the enrollment. So Social Security has a tab on their website just devoted to Medicare. It tells you when to sign up, how to sign up, what your options are. It even goes over, like you mentioned earlier, if you're still working, some of the decisions to make, and then Medicare.gov. Medicare.gov is the only federal government website, so all of your plans for this year and next year, for your drug plans and your Advantage plans are listed there. You can search them by your zip code. You can even make accounts on both websites, so you can make a socialsecurity.gov account, you can make a Medicare.gov account as well, and those accounts just help you have more of a personalized search, and it'll save. Once you are on Medicare, you can look up like your claims and your evidence of billing. You can look up all kinds of details as much as you want to on your coverage on there. So those are the two main websites. And again, like you said, if online's not an option, Medicare, 1-800-MEDICARE is the number to talk to an impartial agent with Medicare as well.
On the Medicare site, there is, once they create an account, they can actually individualize and put in all of their medications, the pharmacists they use, and the program will display the best plans for them to enroll in that would cover their prescriptions the best.
Yeah.
I'm curious, in both of your expertise, is there anything that you find often with individuals who it might shock them from year to year? Is there any pointers that you could give people that might be trying to go through this process, things that you've just seen in your time?
I think what we see the most is for somebody that's new to Medicare, it's a cumbersome process. It's so many different pieces to it, whether you're on Original Medicare or the Advantage, because they need to make sure their doctors are in the Advantage plan. I mean, there's so many different little nuances to it that they really appreciate the assistance and somebody that just can sit down with them and explain it in layman's terms. This is what your options are.
Absolutely. And I would say we're used to, or a lot of folks, I should say, are used to kind of having the same coverage. If your spouse has been working and they handled the family coverage. And so when we meet with couples or married individuals, one of the things that I think surprises them the most is sometimes they're not on the same plans anymore. Because Medicare is individual. So it's one person, it's one person gets their A and their B, one person gets their supplement or their drug plan or their Advantage plan, and then the other person has their plan. So Even my parents, they're on two different plans, and I think we all can come up with cases like that. But I always joke with folks, and they're like, "Well, I want the plan that my husband has, or I want the plan that my neighbor has," and it's like, "Well, are you on the same medications? Do you see the same doctors?" So we really want to make sure that they're making informed decisions.
Final question for you both: best piece of advice for people going through this? If you could tell them one thing, what would you say to them?
Get educated about what your options are, all of the options, so they can make the best decision for themselves.
I agree.
All right. Well, Carolyn Connors from SWRCA and Melanie Garland from SHIP, thank you both for making time. We really appreciate it.
Thank you.
You're welcome.
Thanks to our guest for joining us to learn more about Medicare enrollment. I'm Noah Alata, Chief Communications Officer at the University of Evansville. Thanks for watching WNIN Newsmakers.